Hey, why am I dancing, people? What's going on? This is Carlos St. Just, licensed acupuncturist, holistic healthcare provider. First time I did a video with one of these on, you know what I'm saying? What are we doing? What am I still doing here in the clinic? Do you see anyone here? You don't see anyone here, do ya? Alright, so maybe I can take this off a little bit. Okay. I'm gonna shut the door and then we're gonna sanitize this place. We're gonna sanitize the air. We're gonna get rid of all the aerosols. How are you doing today? Stressed out, I know, right? Scared. Yeah, me too. But it's okay. You know what we can do? We can focus on the present. We can focus on things that we can focus on. You know, there's a very good thought, right? A very good quote that a mentor that I listened to told me, and it was and he got it from a book, right? And you may know the book if you heard the quote, but it's the quote is only focus on the 3 feet around you, right? So if it doesn't, if it's not within my 3 feet vicinity, I don't care, right? And just the concept behind that is that you put more of the attention on yourself, more of the attention on the present, and that can help you. And so that's helping. Now, I'll tell you, it comes kind of natural on my end because I've been doing Tai Chi for so long. And that's why I tell people to start because you build up these Tai Chi de-stressor muscles, which kick in. Shoot, anytime something just kind of knocks you off your ground. And so I'm not going to say that COVID hasn't knocked me off my ground and looking back at things, but I'll tell you, I have a different view from. Let me see. Today is the 14th. Today's May 14th, 2020, as opposed to when this first began, at least here in the U.S. And when we first shut down everything, I always use the 13th of March as the shutdown date because that was, I believe, the official shutdown date here in Los Angeles. And now we're getting ready for the states to open back up. What am I going to say? What am I going to say? As an acupuncturist, I follow all the rules. As a licensed acupuncturist here in the state of California, I follow all the rules in terms of how I practice and treating patients well. And, we do well in the community. I've worked in multiple clinics. I work with an orthopedic surgeon. I work with chiropractors. I've treated everything from MDs to nurses to chiros to police officers. And we're in a different time right now in terms of how acupuncture is accepted, right? I think for like the hardcore data geeks, they're still not on board yet, but they will be, right? Especially, hey, I'm science driven and I'm all about studies and things like that. Oh, sorry, I got a weird message, but I. So, sorry, I got a phone call there. Yeah, I'm all about that. I'm all about the studies. I'm all about learning. So, but this is what gets me is that you hear about everything. You heard about, the masks, and we're looking at the research and the social distancing and the shutdown and this and that, but they skip over the traditional Chinese medicine. And I think part of that is one, obviously, we want to find a vaccine for this virus, right? It's going to be simpler in terms of administering to a mass population and keeping them safe. I tell people, you can, McDonald's does worse. Let me move my mustache out of the way so you can see. Yeah, trim. McDonald's can do worse for you than some of these viruses, right? Not some of them, than all of them, right? Okay. I like to be technical here. And so, you know, so and my gripe, I would say, is that I wish here in the U.S. we would integrate more traditional Chinese medicine and integrate more, speak with licensed practitioners here in the United States. We have governing boards, we have associations, we've been established for years, but a lot of people think in some of the studies, some of the papers or articles, right? There are not papers, they're articles that have came out. They've attacked traditional Chinese medicine, and for good reason, right? In terms of the use of rhino horns and other animal parts, which people don't understand. That is such a small part of traditional Chinese medicine. And number two, here in the U.S., you think people are into that? I mean, we have so many vegans, and the way we study and just the philosophy and how we use things, it's a little bit different. So, don't just assume how something is done in one way in the country that it's going to be done exactly the same way here in the U.S. No, we here utilize everything and we add our own flavor, in terms of safety and regulation and things of that nature. So I'm just saying because people will try to discredit you. I'm used to people discrediting, like trying to, right? And it's unfortunate because if I've been in practice for 8 years, right, I would have been sued. I would have been called a fraudster, uh, knocking at my door. You know, that's that's what if what we did was ineffective or didn't work, or if we weren't researching and studying. So what am I doing? Number one, educating patients on miseducation, right? Misinformation. My bad. Educating patients on the misinformation. I know you saw these two doctors speaking in Bakersfield. I'll tell you, anyone who tells you not to wear a mask, anyone who tells you that this virus is a fraud, anyone who tells you anything, go outside and breathe the air in front of someone and stand in front of someone with no mask for like 30 minutes so you can both share the oxygen and pass, molecules, respiratory molecules between each other. You know, just do use common sense, follow the directions in terms of what, or sorry, follow the guidance in terms of what law our governors and lawmakers have set for us, because we're still trying to figure things out. And if you really want to help people get through this problem faster, tell them to incorporate traditional Chinese medicine and acupuncturists in the treatment until we find a solid cure, until we find a solid vaccine. That's what you can do, right? And we are treating already. I'm already seeing patients and treating patients and advising patients, not on COVID-19, not on coronavirus, but in terms of how to take care of themselves. We do have acupuncturists who are working directly with patients, COVID-19 patients, and it's a very sad situation. And if I can end this video with one thing, I want to wish my colleagues in healthcare the best. No matter what you're doing, right? No matter what your area of expertise lies, and no matter how far your education may lead, right, and how far it gets you in terms of your career, right, and what you do and your role, kudos to everyone fighting on the same team. Kudos to all the awesome, 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 well respected, right, emergency room physicians, right, doctors, nurses, ER staff, hospital staff, everyone from the ground up and back down, right? Right. So, just as a healthcare provider, I'm wishing all healthcare providers out there, right? Let's come together. Let's help people. This is our moment, right? in order to, yeah, this is our moment. I'm going to leave it there. All right. Let's do it. This is Carlos St. Just, licensed acupuncturist. I hope you have an awesome, 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 awesome week. Okay? I mean that. Keep growing. Keep doing things. Peace.